Hospital, worked there on the wards for a very long time, moved to the community and to the university where I ran community clinics from the university, particularly in the areas of swallowing and speech. I have a private practice, the Auckland ENT group, and I'm expert advisor for adult swallowing disorders for the New Zealand Speech Therapy Association. So I do many things, and I'm hugely passionate about speech therapy, and what we can offer and use our skills for to support communities, support people with speech and language related issues. Because all speech therapists are really passionate about the fact that communication and eating and drinking as part of communication and cultural norms is hugely, hugely important. So I'm going to share a few slides, but I really want this to be an opportunity for people to have a speech therapist in the room, talk to a speech therapist, and hopefully I can tell you a little bit about how to go about seeing a speech therapist if it's something that you're interested in at the end of the talk. So let me just share my slides with you all. Great. Okay, so I'm going to talk about the speech therapist's role. If people don't know much about it, we've got a pretty weird old job because we work with people with communication disorders or difficulties, so language impairments, speech impairments, as well as swallowing and cough impairments. And that history sort of comes from the fact that we work with the head and neck as well as the brain, and how the brain sends messages to the head and neck and mouth and throat. So with our areas of specialty in head and neck anatomy, physiology, function, we sort of over time taken on this swallowing and cough role alongside the speech and language role that we have typically had. Many of you might know of our role in children, where we might work with children who are having difficulties developing those skills, but many of us specialize, so about half of speech therapists would specialize in health and acquired problems with speech, language, and swallowing and cough in adults. So as a speech therapist, I can contribute to the assessment of someone's difficulties and help them work out what their problem is and guide them with what that might mean in terms of a diagnosis or a plan for treatments. A speech therapist can provide general advice, strategies for improving everyday life with those problems. And finally, we can actually provide rehabilitation to improve that function. And there's increasing evidence of the benefits of neuro rehabilitation in progressive diseases, such as Parkinson's disease, motor neuron disease, and MS. And in some of those situations, it is to cure or fix problems that have occurred in people who've had an acute event like a stroke. And for others, it's to improve things or maintain things so that function doesn't get worse over time. So from a perspective of communication at its broader level, language, when we talk about language, we're talking about how we find the words we're looking for and use them in sentences, how we write them, and how we gesture and sign, and they're all in the same part of the brain. So often we find that someone is having similar problems with their written communication as they might be with their verbal communication. And that's not just the producing it, it's also the understanding it, and understanding what other people say to you. And largely when I was trained, we were told that this was not a problem for people with MS and that this would remain relatively intact. But over time, we've got more and more evidence of subtle changes in language for some people, difficulties with processing a conversation or a discourse, topic maintenance, so staying on a topic, being fluent and fast in word retrieval. And these are considered to be more common if people are having other processing and cognitive difficulties. They're certainly more common in pediatric and progressive forms of MS and over time. But all difficulties are not the same for every person, and some people will have these problems and will recognize them, and some, of course, will not see this as an issue at all. In contrast, speech has always been considered a more stable side of MS. It was always there from the first reports of MS as an early symptom. For some, the literature now says that about a third of people will have some sort of speech problem. And if they have plaques in their cerebella, which is the part of the lower brain where speech is coordinated, you may have more problems with speech. And when we talk about speech, we're talking about the actual production. So the articulators, the tongue, the lips, the palate, and instead of problems with word retrieval and fluency, we're talking about articulatory precision. So a sort of slurring of the words or a slowing of the speech, or a change in the voice quality, or sustained ability to keep the voice going. And alongside that, we can have problems with breath support, so running out of breath while we're talking. But the literature suggests that while those are quite common problems, seeking speech therapy is relatively unusual in MS, which is very different to our other populations we work with, like Parkinson's disease, where almost everybody with Parkinson's disease will have seen a speech therapist. This is a recent paper that came out a couple of years ago, and you can see the sorts of problems that people with MS said they were having in terms of their speech. So you can see word finding difficulties, getting off topic, imprecise articulation, slow speech, weak voice, change in voice quality. And as you can see, the more frequent problems are the ones at the top of the screen. And when people were asked what they did about that, what was interesting was that few mentioned getting help from a speech therapist, or getting help from someone else. And most people's strategies really related to, as far as I would consider what they've said, to avoidance or relying on someone else, rather than rehabilitation and autonomy to give your own voice, which would be really against what a speech language therapist would be always trying to do, which is give people their power and their ability to communicate their own needs and desires and opinions. So that side of things is probably a little concerning to us as speech therapists. The other more concerning side is that alongside those speech difficulties, what we often get is swallowing difficulties. And you can see here this paper from just a year or so ago reported dysphagia or swallowing difficulties in 45% of people. And that's because we use a very large amount of our brain when we swallow. We need the motor sections of the beginning, and sensory sections of the brain that are up in the front of our brain because they innervate the sensation and motor function of the mouth and throat. But we also need the back of the brain where the brain stem is because that's the center pattern generator. So that's where all of the swallowing is triggered, initiated. And the other problem with swallowing is that it's a respiratory act as well. So we need to stop breathing in order to swallow. And if we don't get that quite right, the two tubes don't do quite what we want them to do. We want the airway closed, the food pipe open, not the airway open while we've got food going down, or we get things going down the wrong way. And the other side of swallowing is it goes all the way from the lips all the way through to the stomach. So we have the intestinal side of swallowing where the food pipe itself or the gut may not be doing what we want it to and may not be passing food and drink down in a timely manner. And maybe one of the reasons why we don't see people with these sorts of problems is that they come on quite slowly and progressively, or they're transient and they come for a little while, but as you feel better, they go away again. And sometimes we find in patients that it's more that there's just other stuff going on that's even more important to you at the time. And so these symptoms of slight swallowing problems take a back seat while we're dealing with something bigger like falling or something that's worrying us in our lives. So the main issue with the swallowing disorders side of things is that it's so interactional with the whole of our body. And that's why it can break down, that we need that brain function, we need the respiratory function, we need the gut working, and we also need attention, concentration, energy. So we need to not be fatigued in order for all of those systems to work. And so the idea that people with MS might not be coming to speech therapy is concerning when we know so many parts of the body can lead to a swallowing difficulty. And the reason why we're so concerned by swallowing is really this consequence of swallowing that not only, as I said, is swallowing such an important part of social life, but it also has risks to our airway, to our lungs, that if we choke, things go down the wrong way, we get chest infections, and chest infections can make us very unwell and hospitalized, but can be fatal. So we really do need to protect our lungs from airway compromise, things going down the wrong way. But the other side of more subtle swallowing problems is the inefficiency. So the fact that it can slow down our meals. It can make us select our diet and lose things from our diet that are actually really important for us, like protein in meat that keeps our energy levels up and keeps our muscle percentage, so that our muscle bulk enough to keep us healthy, strong, and lacking in fatigue. So that sort of double-edged sword of risk to the lungs, but also risk to nutrition is really important when we are getting older, when we have a diagnosis that potentially we need to stay as fit and well as we can. And so these are really important things for us to pick up and be getting support from somebody for. And a speech therapist has lots of ways that they can look at someone swallowing. Some of you may have had a video fluoroscopy, an X-ray of the swallowing, the picture on the left-hand side, where we can give you something that shows up on the screen and it allows us to see where the food and drink's going and see if it's going the right way. We can also do the test that you can see in the middle sometimes with an ear, nose and throat doctor who you may have been referred to, where we can see that the food and drink in real life, and we can see how the vocal cords are closing off the airway, and we can see that things are going the right way. And sometimes we might do some respiratory tests, like you can see on the right-hand side, where we're testing whether you've got a strong enough cough to clear anything that goes down the wrong way. And these are all really important parts of swallowing assessment. There are a number of very useful scales that are out there that help people to see how their swallowing is and to inform their neurologist or their general practitioner, their GP. This is a general scale that we use in all people who have concerns with their swallowing. And if you score over 3, it's a great idea to talk to your GP or your neurologist about it and say, I'm a bit concerned my swallowing is not as good as it should be. There is also a scale specifically for MS, which does a similar thing. You count up your scores of problems and it tells you how you're doing and whether you need to see your neurologist or bring this up at your next appointment. So as a speech language therapist, not all these things are done by the speech therapist, but these are the sorts of things we'd often be thinking about when we're trying to help someone. Alterations to their meal to make them safer or enjoy the meal more, exercises to strengthen and improve swallowing, working with our ENT doctors on surgical options to protect the airway, get mobility working, or medical interventions, so pharmaceutical interventions that might help the gut move more quickly if it's slowing down over time, as well as working with our dietitians and our dentists to ensure that the mouth is as healthy as it possibly can be and the body is getting all the nutrition that is needed. So swallowing and speech is very rarely a single discipline activity. It's usually done by a team. The speech therapist's main role is in assessment and then this area of rehabilitation. And we're getting increasing evidence that we can improve quality of life and independence with neurorehabilitation, physical neurorehabilitation with your physiotherapist, cognitive rehabilitation with your occupational therapist, and the speech, swallow, cough therapies with a speech language therapist. And we know now that we can improve function with these activities. I've just popped a few photographs there to show you some of the things that we can do. On the left-hand side, we've got an exercise we often do for the muscles that hold the airway closed, and that's can be a really useful exercise for people. Here we have someone doing some strength of their tongue exercises, so strengthening their tongue by pressing down on a tongue bulb that helps them work on their tongue strengthening to help food and drink go down, but also speech to be more clear. We can use techniques like this gentleman is using, where he's hooked up to watch his swallow muscle activity, helps him to build some stronger swallow function with the aid of the visual support. And here we have someone doing expiratory muscle strength training, and I'm going to talk a little bit more about that. At the University of Auckland, we've been looking at expiratory muscle strength training in a number of populations, Parkinson's disease, cancer of the head and neck, and people who are deconditioned after a period in an intensive care unit. And we're getting really great improvement in cough strength, which we need to protect ourselves, swallow safety, and in strength of speech and voice. And there's this one paper that has looked at it, particularly in MS, and they also found that people felt that their swallowing was improved with the exercise. So this is a really interesting additional opportunity for people to do something else to strengthen their speech, swallow and voice and cough. And I'm just going to go back to show you what it looks like. You blow into a little tube, and we can change the resistance of how hard it is to blow and release a little valve. And you do it each day for a few days a week for a period of time. And we get all these really interesting benefits from it. So it's just worth, I'm hoping what I'm doing is giving you some ideas of some things that are coming up in the science literature that can be helpful if we're trying to strengthen our head and neck speech, swallow, cough mechanism. So the best therapy for swallowing is swallowing. So we really, as speech language therapists, will be getting people eating and drinking as long as possible, as varied as possible. So we really try to avoid people having to modify their diet to be too simple. And we know that for swallowing, this will improve our saliva management. So it will get rid of the saliva that might be sitting in the mouth and maybe drooling forward a little, because it helps with the swallowing of those secretions down. It will help our weight. It will help our taste and our sensation if we're giving it lots of stimulation. And it will also avoid us getting disuse atrophy or deconditioning or need tube feeding if we can keep the swallowing going for as long as possible. And the same is true of speech, clarity, that we know that, and voice strength, that we know that the more we talk, the more we voice, the stronger our voice and our speech mechanism will be. So we know that we need to use it or lose it. And one of our most vulnerable times is when we retire and we stop using our voice so much. Often people say, my voice was great while I was working, but I found it's really not as strong as it used to be. And we now know that that is absolutely true, that our speech and our voice and our swallowing is all an activity that needs to be continued. We need to exercise these muscles in order to keep them going. So my key messages really from a speech therapist's point of view is that communication, swallowing and cough changes can be common in MS, and they're generally complex and varied, and everyone will have a different experience depending on areas of your body and brain that are causing you the most trouble, as well as obviously how progressive your MS disease is for you. My second message would be that speech therapy does appear to be underutilized as a service internationally. So this is not just a New Zealand thing, but a speech therapist is available under the public health system, as well as in private clinics, and they can offer assessment, advice, and rehabilitation. And we're getting increasing evidence that rehabilitation or habilitation programs will help us to maintain our speech and swallowing and cough function, and are therefore worth us considering to keep ourselves strong. I've got a couple of websites here from the MS Society in the UK, one for swallowing and one for speech. And I'll make sure that you get these to look at yourself. Hopefully they're useful to you. And I look forward to hearing more about how I can be of help and what information I might be able to offer you all. So I will unshare my screen so we can have a conversation.
Thank you so much. It was a really interesting talk, and I was particularly interested in the low rate of seeking help. And I guess the workarounds that people build into their lives. So we do have one.
Yeah, sorry. I think so, and I think that's the problem, is that I think all of us are guilty of it, that we try and live with what we've got, and we suck it up and just get on with life and come up with compensations that seem to work for a while. But a speech therapist is very willing to help with those problem-solving activities. Yeah, we're certainly there. We're not the hugest profession in the world, but we're out there.
Along those lines, is there research into the benefits of or the difference that early intervention might make to progressive, you did mention progressive disease?
We don't have that information in MS. And partly probably because of this issue that speech therapists just haven't traditionally been involved. So there is also a lack of research in that area. But we certainly see that in other neurological diseases like Parkinson's disease, where we know that the earlier we get in with the therapy, the better we can maintain function. Yeah, so absolutely, it's better to go to a speech therapist early. I can see Penelope's asked a question about that. See a speech therapist when we start having symptoms, even if they give some advice and then you go away for a while and you do really well for 5-10 years. A speech therapist will always be willing to hear from you again. So it's always worth seeing what they've got to offer.
Thank you. So the next question, in fact, there's two questions about the expiratory muscle strength training.
Yes.
Where do we start? Do we need a referral to a speech and language therapist or a physio? And the other question on that is, can we buy that blow tube thingy?
Yes. Yeah. EMST, we tend to call it EMST, because expiratory muscle strength training is a mouthful. It's advisable that you see a speech therapist so that they've done the right assessments to make sure that it is the right approach for you. But yes, you can go online and buy one yourself. And not all speech therapy departments have it funded at the moment. So it may be in some regions that your speech therapist says, I think this might be helpful for you, but I don't have access to them currently. We're working quite hard on the research in our lab to try and make this evidence-based strong enough in New Zealand that Te Whatu Ora does fund it for all, but that's a little work in progress. So some places will have access, and some it might be that you are purchasing it yourself. They are not expensive. They're $150 to $200. and then you've got it for life and you use it for you. So I'm working hard to make sure that the public system has that available, because I don't think it's an expensive thing for them to fund for us. We don't ask for much in speech therapy, and there are other disciplines that are a lot more expensive on the health dollar than we are. Yeah. So while you could buy one yourself, I would recommend you talk to a speech therapist and make sure it's the right thing for you first.
Thank you. So somebody said that they have lesions on C1, C4 to 5. They have swallowing, cough, and speech problems. Is this caused by those lesions?
Yeah, that's a good question. And I did talk about the brain and the brain stem, which is the bottom of the brain where the cranial nerves that innervate the mouth and throat come from. They pass through that top part of our spine. So any lesions in that those high C lesions in the spine are well known for causing speech, swallow, and voice problems. So I'm quite sure that will be the case. We see the same with people who've had spinal surgeries in the top part of their spinal cord. It's a very vulnerable spot, and the cranial nerves have to move so fast for swallowing and speech that they're very vulnerable to any type of damage. Yeah.
So there's two questions about the speech and language therapy profession. One is, when is the right time to be referred? And the other question is related to that. What is the best way to get speech and language therapy? The neurologist told me my language was fine. My GP suggested help or wait until robots can talk for me.
Oh, great. Useful advice. We're all waiting for technology to help us, but yes. So speech therapy can help at any stage. So they can help when you're having very mild slurring of the speech or just mild problems with the swallowing that just are a niggle. And that's certainly a good time to see a speech therapist, because we can work on things to try and avoid it getting any worse. But we can also work with people who have more severe problems, who perhaps are not eating and drinking and are using a tube and want some help with their saliva management, or are finding it very difficult to talk and need the help of communication aids. So a speech therapist will work across the broad spectrum, whatever your problems are. And we'd welcome the referrals at any stage. Your GP and your neurologist can refer you to speech therapy. And hopefully tonight helps people advocate a little bit more for themselves and not take no for an answer. There is no reason for neurologists or GPs to be gatekeeping speech therapy. Speech therapists are trained to work with people with progressive and neurological diseases and welcome them on their caseload. So you can go through your doctor. Many of our neurologists in Auckland are very pro speech therapy if they think it could be helpful. So I'm sure that you can get some traction with your doctor. But actually, you do not need a doctor's referral. It's useful for your doctor to be involved, but you can refer yourself to speech therapy yourself through your community team. So if you're in Auckland Central region, it's at Green Lane Hospital, the community services. There's also a community service through counties Manukau and Waitemata. So every Te Whatu Ora region has a speech therapy service that works in the community and will see you at home. And they should all accept a referral from you directly, even if they then ask permission to access your health records through your general practitioner or your neurologist. So they've got access to more of your information.
Fabulous. That's really useful to know. Just one more question sitting there. Can other activities like singing be useful?
Great question. Yes, absolutely. As I said, just keeping working can be a good exercise for the voice. And we have some wonderful neurological choirs in New Zealand that have proven efficacy for improving, maintaining our voice and speech function, as well as our well-being through the social activities. So yes, we would always recommend things like choirs and general physical activity, going to the gym, walking. We need breath for speech. And so any activity that's improving your respiratory function is going to improve your speech. And as I'm sure many of you know, fatigue is the killer of our speech clarity. So anything that keeps us well and tries to control and manage our fatigue levels will lead us to have stronger voice and speech.
Thank you. A speech and language therapist gave up on me and referred me to TalkLink, so I am reluctant to try again. Should I?
Yeah, good question. And I understand. I understand the frustration with that. I think what sometimes happens is that a speech therapist will feel they've come to the end of that current situation and that current sort of phase of treatment. And that can be really tough to hear. But often a speech therapist will be happy for you to refer yourself back for more support at another time if your function is changing. So while things might not have been, they couldn't think of anything else they could offer at that point in time, maybe things have changed and there is something that they can offer now. And as I say, we also have differences in our knowledge, we progress the field, and there are things we do now that we didn't do 5 years ago, like the EMST. I think it's always worth engaging with a speech therapist again if you feel like you have not reached the end of your journey of working on your speech or your swallowing. Yeah. TalkLink, of course, is a fabulous option to support us with communication when communication gets tough. It's an organization, for anyone who doesn't know about it, that will help with augmentative communication. So communication devices and ways that we can talk without our speech when our speech has become very difficult. And of course, the TalkLink organization also changes their evidence base regularly as new things come up, and Gen AI and technology has hugely changed that space in the last 12 months, never mind 5 years. So I was at a meeting at Parliament with a group of leaders in speech therapy yesterday, and TalkLink were there, and they were saying, this is tough. Everything we knew 12 months ago, it's all changed. We're having to upskill ourselves to understand how we can use this technology and still be skilled advisors. So yeah, the world changes around us. So there's always hope. Not waiting like your GP until computers can do it for us, but using these things to really help us with technology that helps rehabilitation and supports us. Oh, and yeah, MS Auckland Community Advisors apparently will help you get your referral to speech therapy too. Yeah.
Yep, absolutely. We can help with that. So please reach out to community advisors. Yeah, that's great. It doesn't look like there are any more questions. So I think we can close off there.
Great. I've left my email on the slides, and I'm really happy to receive any emails from anyone who's struggling to get services or wants to know what we're doing at the university on rehabilitation. I'm happy to help anyone if I can.
That's very generous of you. Thank you.